Hello, I am Andrea Cooley, one of the co-owners of Des Moines Moms Blog, and today we are excited to be at the Des Moines University Clinic, which is located, it's part of the Des Moines University campus. It is off of 31st Street on Grand Avenue. It is a large, newly remodeled tower that you can see right from Grand. And you might be able to see there's some great views of the downtown and other parts of Des Moines here. So today we are excited to be talking with Dr. Catherine Heineman and Dr. James Philson. They are both professors at Des Moines University, and they also practice in the Osteopathic Manual Medicine clinic. So we are going to be learning more about osteopathic manual treatment and what kind of services that they offer today. And I'm especially excited to learn more about this topic. It's something that I am passionate about, something I received treatment during my pregnancies, and it was really beneficial for me. So I hope that it can be helpful for you too. If you have questions as we are talking, feel free to post them in the comments and we will answer them at the end. So I think the first question I have for you is just, can you give us a brief explanation of what osteopathic manual medicine is?
So varying length answers for this, we'll try to keep it relatively brief. The idea behind osteopathy is to try to get the person and their body to work as best they can, to try to maintain health and deal with the challenges that the world throws at us. The manual medicine aspect is we're using our hands to do that. So we're feeling areas of the person, their body where things are tight, structurally where they're not moving very well, implying that the function of that region or structure is not working very well. And so we use our hands to get those areas to move better, to flow better, to work better.
Okay.
And that's to shorten the skin.
Sure.
Really.
Yeah, exactly. Just to kind of build off of Dr. Philson, it's osteopathy or osteopathic manual medicine is sort of the science of the living anatomy and so not only that, but so we can palpate the living anatomy, but we're also palpating function. And so, and that's what Dr. Philson mentioned too, that you know, what's not working well within that system, what's not functioning appropriately, and then we address that through the anatomy. And so it can be a bone, it can be a muscle, it can be a nerve, but helping to improve circulation, helping to improve lymphatic flow, which can help with inflammation. So those are a couple areas that we're looking at. But basically, you know, when life throws all kinds of things at us and we have these stresses and strains, even birth is a big strain on the system. So what things aren't working quite as well, that just by palpating that anatomy, helping with the function, now you can improve a lot of symptoms that we find.
Can you explain in more day-to-day terms, like what palpate, what that would mean?
Yeah, thank you. Yeah, so palpating, just using our hands.
Okay.
And so this is just a skill that we learn throughout all of medical school. That's where we start to learn it, and then it's just a continuum. So it just kind of, you know, the more you use your hands, you continue to get better and better at palpation. So we're used to feeling things like rough and smooth and hot and cold, and that's about it. But you know, we really have all these proprioceptive endings, these nerve fibers on our hands, that there's so much more that we can feel. And as you continue to kind of develop that skill, you're able to palpate more and more, or feel more and more things in the patient.
I think people have got the idea, but palpate is a synonym for feel.
Okay.
To feel.
Yeah. So what kind of services or what reasons would somebody schedule an appointment for an osteopathic treatment?
Services to schedule for it. So there's lots of reasons. Perhaps the most popular one nowadays that we see people for is pain, but it's not limited to that.
Okay.
Certainly there's a fair bit of data that this is useful for both acute and chronic pain. But it's really anything where there's a problem with function. So thinking of children in particular, speaking as a pediatrician, very common early in life that I see kids for is problems with breathing, I've treated a lot of kids within the first hour of life, attending a delivery, and yeah, I got a kid who's not breathing very well. I got some fluid in their lungs. This is what I would turn to, other than stimulating and maybe doing some suctioning. But I would do this to try to help the kiddo deal with the fluid in the lungs, help the lymphatics, help to drain it, help the mechanics of their chest be able to expand better so they can get some air in there, decrease the pressure in the venous system, the veins, to get the fluid into the veins and out of the lungs. Problems with latch, sucking, if there's problems with the nerves that control the throat and the mouth are being a little bit pinched, it can affect the child's ability to use their tongue and to coordinate a suck. If there's muscles up here in the front of the neck that are tight in certain ways, it can affect the child's ability to swallow. So we can use our hands to loosen that up and get that working better. Problems with development, a funny shaped head, problems with reflux, that's very common. Other breathing problems, asthma, in the hospital, atrial fibrillation, infections. It's one of the great things being a general pediatrician, as I was for 6 years. Somebody comes in with a cold, they got a virus, they got bronchiolitis. They can actually do something to help the person deal with that and adapt to it better. Just some ideas.
Yeah, those are great.
Yeah, and kind of building off that too, sometimes, your child will have a fall and they don't necessarily have a broken bone, but you notice a behavioral change after that, or something else changes with the child. And so in an adult, those accidents and injuries might manifest as pain, whereas in a child, it doesn't always. It depends on the age of the child, but a lot of times a younger child might not, sometimes they experience that as pain or just an accumulation of some of these, normal childhood falls and bumps and bruises and that type of thing. But those are also things that we'll look for and can help with. We're sort of we think we're treating one thing, and because the body is so interconnected, there's all these other kind of, improved
symptoms
So you notice, some of those things can be alleviated as well. And then just from the adult side, we do see a fair amount of headaches, people with accidents and injuries, but also recurrent infections and breathing episodes, and just really any disease process, because pretty much any disease process, there's some part of the body that's not functioning appropriately, and we can look with our hands to see how can we help that system work better.
Okay, yeah, I know I had mentioned early on in all of my pregnancies around the second trimester, I would start coming in for treatments, just my hips would be off, or Dr. Heineman treated me for different times that just low back pain, or and that would lead to trouble sleeping, and she would be able to do some small adjustments that made a big difference. And then after having a baby, I also your body goes through a lot with that, and so was able to get adjustments there. And then, as Dr. Philson said, I didn't have treatment in the hospital for my newborns, but brought them shortly after delivery for them to have, some treatments there. And one of my son was having problems latching, and so we did some work on those kind of muscles as well for breastfeeding.
Thank you, Andrea, for mentioning the pregnant patients too, because that's definitely a population that we really enjoy seeing. And just as you said, so what we're trying to do is as you go along with your pregnancy, there's just so many modifications that the body goes through, and so just to help the body along with that, and it can help with hopefully normal delivery and ease of delivery, and those are some of the things that we're those are our aims that we're trying to support the body through. So
You said something else which reminded me as well, and I was a general pediatrician. Sometimes during like a well child visit, sometimes the kiddos wouldn't have symptoms or problems, but the idea is there to keep the kiddo healthy.
Sure.
And so through the exam, I'd also look for these things, and if there was some significant tightness there, we might treat it, not because the kiddo has a problem, but to prevent that from being a problem.
I love that idea of preventative medicine. So before they get the ear infection, or before they can't sleep, that you're taking care of those things.
And that was another very common thing I would utilize this for, is ear infections and fluid behind the ear.
Sure. I think one question that I've had, or that I'm sure other people have, do you need a special referral to make an appointment at the Des Moines University clinic, for an osteopathic treatment, or is it something that insurance typically covers?
Yeah, and actually you don't. I mean, all insurances are a little bit different, but we typically don't have any problems. I mean, it's kind of rare if we need an actual referral from a primary physician or something along those lines. And really, we haven't had any. We take all insurances.
Right.
We have very little trouble with people being covered for the services.
So essentially, it could be, and I'm sure insurances are different, but it's like an office visit for a treatment.
copay.
A copay. Yes. Okay.
It's probably safest to check with the insurance company quick just to see if you need a referral, but most of the time we don't.
Yeah. And if people have questions, they're definitely welcome to. We'll talk about how to get a hold of us at the end, but that would be a question if you're wondering about whether or not your insurance covers it, and our staff would be able to help people through that.
Another question that I think is common if someone is hearing about osteopathic medicine and a treatment, they'll ask, how does it compare to going to the chiropractor? What are the differences?
Kind of hard for us to answer that question completely because neither of us are chiropractors. But so the answer to this question, with the caveat that we're speaking for the chiropractors, but maybe we don't have the full understanding of what they do, but there's some idea. In general, one of the big differences is that we are kind of fully trained physicians. So, again, I'm a pediatrician, I'm a board-certified pediatrician and a board-certified internist, and so I've got the whole breadth of that. So I've dealt with managing ventilators and prescribing medications, and not many chiropractors can manage a ventilator. So we kind of have that kind of that breadth and depth of kind of what an MD would have essentially. So far as I understand, the perspective can be a little bit different as well. And I've had a chiropractor kind of confirm this for me, that sometimes they tend to focus on the spine and the nerves as the structure there. The chiropractor I was speaking with said, and you DOs, you focus on the arteries. And I kind of smiled, nodded, and said, well, thank you, sir. We actually don't discriminate just on that. We don't discriminate on body tissue. We don't just focus on the bones or the nerves. We literally will treat any body tissue, the skin, the lymphatics, which are kind of the garbage men of the body and part of the immune system. The organs might treat the liver. So really any body structure, and sometimes even the emotions, not exactly with our hands per se, but we're talking. Right. And that becomes an important part of treatment as well. The other bit that chiropractors sometimes are known for these popping techniques. I think they do more techniques than that. We are trained to do those techniques, popping techniques as well. I don't tend to use those on young kids, and actually no DO I know uses those on young kids. So we're kind of known for not always using those popping techniques.
Sure. And we'll take a minute here and show kind of an example of the table and perhaps what a treatment would involve. And I do want to also just have you clarify, you mentioned DO and MD.
Oh, I'm sorry.
Yes. I think that might be things that people don't understand.
Right. So DO stands for Doctor of Osteopathy. That's what Dr. Heineman and I are. That's what DMU produces. Well, podiatrist, but physical therapist. But MD stands for Medical Doctor. So this is the majority of the physicians in the country are medical doctors, MDs, coming from different schools like the University of Iowa.
Sure.
And those who study osteopathy are DOs. All DOs were taught to do this work, were tested on it, were expected to know it. So
right.
if you see a DO behind the name, they were indeed trained to do this.
And part of it too is the philosophy. So there's a philosophy around. It's not really holism. I mean, sometimes you hear that with a DO is sort of more holistic, but we don't actually have we don't have like a stronghold on that
Sure.
on that term. I mean, I think there's lots of MDs that practice holistically, and there's lots of other health practitioners that practice
Right.
holistically. What really sets us apart is this philosophy that we're taught to look at anatomy, look at the function, and treat that with our hands, and take that into account when we're addressing and treating a patient.
Great.
That answer?
Thank you for clarifying. Just wanted people to know what that DO and MD.
Thank you.
Do we have any questions?
We did have a comment come in just talking about care for babies and infants as far as like helmets and misshapen heads. Can you guys talk about kind of what you offer there?
Yeah, so plagiocephaly would be the most common reason to use a helmet. And I'm very biased in this. I'm just going to come out and say that. So we can use our hands to help with that. That was another very common reason that I would see a kiddo in the clinic, and was referred to by my partners to do this. Much gentler, don't have to have a contraption on their head all the time. From an osteopathic perspective, I actually feel the helmets are harmful because we are taking the head, which we feel moves, and you're clamping it down and actually causing that tension that is there and making it worse. Not only that, there is some data out there that the helmets actually don't work very well. So I hope I didn't offend anyone or irritate anyone too much.
But you would have a different treatment.
Absolutely.
Okay.
Absolutely. And this is different from, so I'm talking about plagiocephaly. This is very different from something called craniosynostosis, where the suture, the area where two bones are kind of coming close to each other, is actually fused. That is something very different. That is, although we can help treat that with our hands, we cannot fix that with our hands. And that is something, unfortunately, that a neurosurgeon needs to intervene upon as well.
And so kind of what we're doing there is we're looking at, there's a lot of bones in our head, especially with an infant. Some of those bones haven't completely come all the way together. So even in an adult, we have what's called sutures. So there's the two bones meeting, but there's actually still motion across those suture lines. And so with an infant, it's actually very malleable because those bones haven't completely formed together. So we're able to look at, again, the function of those bones and see what is it that maybe one bone isn't moving quite as well, or how can we change the relationship and the function of those bones. And as far as, and I respect what Dr. Philson said, if you have a child with a helmet, we're willing to work with that, and we can do, we can still do treatment if that's something that the parent wants to work with, or we can have that conversation and decide, if there's other thoughts coming out of that. So,
do you view your treatments as more of an add-on to what like a primary care provider might do, or do you feel like that these can be treatments that you do like on a standalone basis, or in replacing to like your visits to your general practitioner?
Good question, thank you. Some of us are primary care trained, Dr. Philson, for example, with pediatrics and internal medicine. There's also other docs in our clinic who have done family medicine training. We're a specialty clinic, however, so we don't take patients as a generalist or as a primary care practice. So even though we would all agree that we don't necessarily see OMM as adjunct. I mean, we could treat anybody and find some things to help with, but it is in the sense of you do have to have an additional primary care physician who's managing it, as far as pediatrics go, your immunizations, your well child checks, things like that. So you still have that person in the mix, and then we are kind of, I guess, if you will, add on or an adjunct.
And I completely agree. The clinic here is not set up to do primary care pediatrics, and that isn't the intent of the clinic. So yes, a general pediatrician or family practice for well child visits and other things that would come up would be highly recommended.
Okay.
All right. If there are any other questions, we'll do a quick demonstration, and also, so I don't forget at the very end, we've had a lot of great information from both Dr. Philson and Dr. Heineman. If you have questions, feel free to either add them in the comments or go to the website, which is dmuclinic.org. You can get more information there, and also set up an appointment if that's something that you are interested in. All right, so do you guys want me to lay on the table here? Or
That's all right.
Yeah,
Is that
yeah,
okay?
yeah.
Okay. And we talked about this a little bit. I might have you take your shoes off and maybe lay supine if you don't mind. I think what we'll probably show, if we can well, is a general approach to an infant. Dr. Heineman, I'm going to raise the table a bit. All right, just like it. Might have you get all scooped down into it. Just a little bit. Okay, we can touch it. So generally for most infants, I am going to start at the head. Gives me a good sense of really the whole body, but it's also very common for newborns and infants to have issues up there, and it's kind of how I was trained too. And right now with Dr. Heineman, I'm just kind of feeling the motion around at the base of her skull and kind of loosening things up a little bit right there. So the cranial treatments, or the osteopathy in the cranial field, uses fairly gentle pressure the vast majority of the time, especially in an infant or a newborn. As Dr. Heineman alluded to, their skull is largely membranous and cartilaginous, and so it really doesn't take a whole lot to impact that as far as force. The adults that get this work done generally feel that it feels pretty good, really. Generally people enjoy it. So right now I'm kind of more just diagnosing and seeing what's going on here, and overall things are feeling pretty good. There's a little bit of tension over here at the junction of her ear bone and the backbone of her head, which is very common, including in infants. And so a treatment of that would look about like this. And so the amount of force that I'm putting in, and this is, in an adult, is, Dr. Heineman might be a better one to ask at this point, maybe a couple ounces.
Mm-hmm.
What do you think? Yeah. So not a lot of pressure, just done in a very particular way. And in general, in treating an infant, this is the sort of techniques that I would use. They would generally be fairly gentle, not a lot of strength put into it.
I think that's really helpful to be able to see that. From my experience, as a mom, I would just stand here right by the baby, and I think that the provider, I feel like the 6-month mark, it got harder to treat, but the providers were really good at working with them, and if I needed to hold the child,
absolutely,
and figure out the best way to make it.
And not uncommonly, I'm going to kind of move down to your chest so you can see a little bit something different. Very early on in the process, you're okay with me here?
Mm-hmm.
I would come down here and start to evaluate the chest. So while I'm talking, you can kind of see a little bit more gross motion, some of the techniques that we use here. It's a very common thing to do based on the comfort of the patient, the kiddo, and the usually moms there, or whatever parent or guardians there. Not uncommonly, and have the kiddo sit on mom or lay in her lap, or hold the kiddo and treat from there. And the kiddos tend to be a little bit more comfortable there, but again, then I'm closer to the parent, so it's kind of based on their comfort as well. But that's a common thing. As they get older, 2 years was always the challenge for me. Looking in the ears and doing all, and then it becomes a little bit, because they've got a little bit more opinion, and they usually tell you too. They're I don't want to do this right now. No, so it becomes a little bit more challenging there.
And I think, just to finish it up, that usually a treatment is not very long. It would take maybe 5 or 10 minutes, wouldn't you say? You know, it's not like they're spending a long amount of time for something.
Yeah, the initial visit
Sure.
usually is longer because we're having to talk about you know, the history and what's
Right.
going on and doing kind of a full medical eval essentially.
Right. But I think the actual, you know, treatment.
The actual treatment is much briefer.
Yeah.
Depends a little bit on what's going on too.
Sure. Are there any other questions?
No. Okay.
All right, thank you so much. I hope that you guys learned a little bit about osteopathic medicine and treatment, and we'll definitely take a look at the Des Moines University clinic for treatment options. Thank you.